Brilliant. No, thanks very much for inviting me along, and thanks for the kind introduction. So yeah, I'm Jack Benton from the University of Manchester. I'm going to be talking about some of our research that we've been doing around urban green space interventions and mainly around health-related behaviours, and talking about some of the natural experiments work that we've been doing. Oh, there we go. So, bit of an introduction to myself, which I don't need to repeat. Yeah, I'm currently on a Leadership Early Career Fellowship. So I've just finished my first year, going into the final kind of 2 years of my fellowship, which is again all around urban green spaces and health and wellbeing, with again particular interest around natural experiments. So just a bit of background then. So we know that there is lots of evidence that urban green spaces can promote population health and well-being. I think for those who are familiar with this kind of literature and evidence base, there is a lot of evidence which kind of suggests there's an association there between urban green spaces and lots of different health and well-being outcomes. And by urban green spaces, we're not just talking about parks, we're talking about any other kind of publicly accessible green space, whether it is tree-lined streets, woodlands, canal paths. We just, do you know the thing on the side? Just collapse it a bit, just so I can think it might overlap with. There we go. Perfect. Yes, and so we know there's that kind of association there. There's various pathways that explain how urban green spaces are linked to health and well-being. One of the key pathways is by promoting behaviours that we know are important for well-being, such as physical activity and social interactions. And that's predominantly going to be the focus of today's presentation, around that link between urban green spaces and these kind of health and well-being related behaviours. So the issue at the moment with the evidence base is we've got a lot of kind of evidence which suggests there's some kind of association, but I think what we currently lack is a really kind of robust intervention-based evidence on how creating new or improving existing urban green spaces can then have positive effects on various health-related behaviours. I think this is really quite an important problem to address, because we've got quite a big growing kind of response in policy and practice, which are now kind of recommending using urban green spaces as a promising intervention to promote health and well-being and promote these kinds of health and well-being related behaviours. So I think policy and decision makers need much kind of better practice-based evidence on how changing or improving urban green spaces can potentially have positive impacts on these outcomes. So what evidence do we need? Well, my answer to that would be using natural experiments, which are defined as real-world events that are outside the control of researchers, that divide populations into exposed and unexposed groups. That's a definition that was taken from this recent NIHR report on using natural experiments in the context of population health interventions. Before I come on to my next slide, I kind of wanted to highlight that designing and conducting studies around natural experiments is difficult, primarily because these kinds of interventions are outside of the researcher's control. So it makes it really hard to do this kind of research and do it well, which is kind of the caveat that I wanted to highlight before I come on to this slide, which is essentially about nearly 10 years ago now, we conducted this review that tried to have a look at how good the natural experiment evidence base was in relation to built environment interventions and focusing on physical activity behaviours. So we're looking at urban green space interventions, but also looking more broadly at other interventions in the built environment, so things like active travel infrastructure, for example. And we had a look at the time, we had a look at the 12 kind of strongest natural experimental studies that had been done at that time. And without going into too much detail, we used a risk of bias tool from the Cochrane group to assess risk of bias. So risk of bias is essentially the likelihood that the way that a study is conducted or designed is likely to give misleading results. And we found that all of those studies that we assessed had either a critical or a serious risk of bias, which again suggested that the kind of quality of the evidence at that time wasn't particularly great. And this finding has been kind of it's in line with other more recent reviews, which has suggested that there is kind of these common issues that are happening from a methodological point of view with this kind of research using natural experiments. So within that review paper, we made these 8 recommendations that attempted to try to address the kind of common methodological weaknesses that we had found in that review that were causing that kind of high risk of bias. And these recommendations focus on various aspects of these kinds of studies. So looking at improving the use of control sites, using multiple control sites and improving matching of control sites, looking at statistical analyses, publishing study protocols with analyses kind of pre-specified to improve transparency in the field, looking at use of adequate outcome measurements, so not relying on just a single outcome measure, for example, think about sample size calculations, looking at improving the reporting of samples and interventions, which was quite a common issue, and also looking at intervention exposure, particularly in terms of those measures that aren't focusing directly on kind of intervention sites that are being assessed. So we made these 8 recommendations, which set ourselves up to try and actually implement some of these recommendations, coming back to what I mentioned before, that doing this research is difficult. But nonetheless, we had a few opportunities in Manchester to try to implement some of those recommendations in our own natural experimental evaluations. So today, we're going to focus on one particular study that we conducted, and that was focused around a sponge park that was built in Manchester in 2020. So the idea with the sponge park is that it involved these kind of sustainable design solutions to reduce the risk of flooding in particular in the area. So it had features like rain gardens, for example. And this park was built in a really highly deprived urban area in East Manchester called West Gorton. At the time, I think it was in the top 3% nationally most deprived areas in England and Wales. So really highly kind of socially and economically deprived area. And the park that was built was co-designed with residents to ensure that they had an input in terms of what the design and what the park would actually look like and what the park would actually contain. So this allowed us to design a prospective natural experiment evaluation. So here's a bit of a before and after example of what the space looked like before in 2018 and then what it looked like in 2020. And the local council, Manchester City Council, essentially expected or hoped that the park would result in positive changes for the local community in terms of things like getting people to use outdoor spaces more often, access to green space, engage in more physical activity, promote social interaction, promote engagement with nature. And essentially we want to kind of test these assumptions in our own robust natural experiment evaluation. So in terms of the study design that we used, we did this pre-post control natural experiment study where we collected data at baseline, pre-intervention, and then collected multiple follow-up data collection periods over a period of time that I'll come on to in a moment. And we essentially had these 6 key sites that we focused on. So we had 2 intervention sites within the park itself in West Gorton. We identified 2 matched control sites elsewhere in Greater Manchester, which we identified using a new process of control matching that we developed, which I'll come on to in the next slide. And then we also had these 2 nearby unchanged sites within the neighbourhood of West Gorton to look at things more like around the potential displacement of activity from nearby public spaces and to assess general activity in that neighbourhood over time. So just on how we actually identified our control sites, so just taking it back to that review that I mentioned before, from the studies that we looked at, we found that the general approach for identifying control sites in these kinds of evaluations was really quite weak. There wasn't really any kind of systematic process to it. And it meant that the control sites that were typically used weren't really particularly comparable at baseline to the intervention sites that were being assessed. So we tried to address this by developing this 5-step process of how one would actually identify these kinds of control sites in this kind of research. I won't go into the details. You can find more details in this protocol paper that we published for a separate evaluation quite a few years ago. But essentially, this process allows you to identify similar neighbourhoods that are matched on various characteristics that we know are important for physical activity behaviour, so things like population density, levels of deprivation, levels of greenery in a neighbourhood. So we work with researchers at University of Manchester who are experts in GIS data to use these kind of data sets to identify similar neighbourhoods at the kind of LSOA level, so the lower super output area level. And then within those neighbourhoods, we then use this process to gradually, again, look at different kind of more site level, street level characteristics within streets, within each of those potential comparison neighbourhoods to identify these kind of candidates for control sites for our evaluation. Again, working through a relatively systematic process of working through these variables, for example, access to certain destinations and services in a street, and then matching at the street level, looking at streetscape characteristics, and then eventually doing kind of on-site visits to these potential control sites that you've identified through this process of matching. So it's a bit of a long process, and we hope that it's kind of trying to improve at least the kind of objectivity in the sense of this kind of process of actually identifying sites that can be used as a relatively comparable control within the resources and constraints that one would have in this kind of research. So in terms of what we're actually interested in, so our outcome measures, so as I mentioned, we had those intervention and control sites, and we had kind of two main outcome measures that we were using. So firstly, we used behavioural observations. So during my PhD a number of years ago, we developed this observation tool called Mohawk, which you can find on that QR link if you're interested in reading a bit more about that. But essentially that tool assesses 3 behaviours that we know are important for people's well-being based on the 5 ways to well-being: physical activity, connect behaviours, so social interactions, and then these take notice behaviours, so people engaging with the environment around them. So we use these unobtrusive, systematic observations using the Mohawk tool, which also assesses 3 broad estimated demographic characteristics of observed people, so age group, gender, and ethnic group as well. So we use this tool at baseline, pre-intervention in 2018, and then we kind of replicated that schedule 2020 for 3 months post-intervention, 2021, 15 months post-intervention, and then more recently, over summer, we did it kind of longer term, 5.5 years post-intervention follow-up, again, using the same procedures. I'm not going to talk about the 2025 follow-up because we're currently doing the analyses for that, so I'll focus more on the shorter term follow-ups in this presentation. And to kind of triangulate the observational data, we then also collected intercept surveys with people at both, again, intervention and control areas, and that was mainly to assess changes in self-reported well-being, but also assess self-reported changes in physical activity. So we're going to focus more on the physical activity stuff for this presentation. But again, we collected that data at baseline in intervention control areas in 2019, and then we did a 13-month post-intervention follow-up in 2021. We also did it in 2025, so I don't know why that's missing on there, but again, I'm going to focus on the shorter-term follow-up in this presentation. And just coming back to what I mentioned before about that review, so one of the recommendations that we had, there was none of the studies that we looked at in that review paper had published a study protocol. We think it's really important to try to publish study protocols if researchers can, to increase transparency, reduce the risk of things like selective reporting bias. And I think also importantly for natural experiment research, given that the intervention isn't kind of under the control of a researcher and things like timelines can be difficult, I think it improves study planning, so planning for kind of contingencies if anything goes wrong, which I think is really important for doing this kind of research well. So if you're interested, that we publish that on the Open Science Framework, which is a nice kind of free database that researchers can publish protocols on, which I think is really good. So you can access that protocol there, which was published back in 2020, I think, just after baseline. So yeah, we published a study protocol which informed what we were going to do. Next few slides, we're going to talk about some of the results. So our main outcome of interest from the behavioural observations was simply the number of people that were observed walking from baseline to each of the follow-ups and comparing the intervention versus the control sites. So the green line here represents the intervention sites, and the grey line represents the control sites. And what you can see is that over time, there was quite a sharp increase in the number of people that we observed walking at the intervention sites at both follow-ups, and then a slight kind of decline over time in the control sites. And we conducted multi-level regression models, which showed significant increases in observed walking relative to the control sites at both 3 months, and then a slightly bigger relative increase at 15 months post-intervention. The secondary outcomes that we looked at using the Mohawk observation tool were these other behaviours that the Mohawk tool assesses. So looking at vigorous physical activity, which is essentially running or cycling, sedentary behaviours, so whether people are sitting down or also standing still in an area, and then these other 2 wellbeing related behaviours, so connect, whether people were socially interacting, and then these take notice behaviours, so whether people were explicitly taking notice of the environment around them. And again, I'm not going to go into the details here because of lack of time, but we essentially saw kind of these significant increases in a lot of these other wellbeing related behaviours from the intervention side relative to the control sites. And finally, with the Mohawk observation tool, we also looked at these kind of exploratory outcomes just to see whether there was any changes in the observed demographic characteristics of the people that we are observing in each of the intervention and control sites from baseline to follow-up. Picked out a couple of probably the most significant findings from that piece of work in terms of significant changes in the number of children and teens who are observed in intervention sites, and then also a significant increase in the number of people who are characterised as non-white by the observers, again from baseline to follow-up. Again, you can see those kind of significant jumps in numbers of each of those demographic characteristics, which we'd start to explore a bit more into more recent qualitative work, which I'll come on to in a moment. As I mentioned, we also did some observations in 2 nearby unchanged sites within the West Gorton intervention neighbourhoods, and we want to look at whether there's any potential displacement of activity from nearby existing spaces, and also to assess whether there's any general change over time within that neighbourhood that potentially might explain some of the increases we see at the intervention site. What we saw there was that these nearby spaces, there was actually a 17% observed increase in the number of people who were using those nearby unchanged spaces. But importantly, for the purposes of this study, when we did an analysis, we saw that there was actually much significantly bigger increases in the intervention sites compared with the nearby unchanged sites, again suggesting that it's more of an effect due to the intervention rather than something else, perhaps maybe more people using outdoor spaces in that area, perhaps maybe due to population changes in that local neighbourhood. As mentioned, we also conducted intercept surveys. So in total, we did 623 intercept surveys across intervention and control areas. This graph here simply shows responses to one of the questions that we asked around self-reported outdoor space use. So you can see the green bar intervention area, grey bar is the control area. You can see that actually from 2019 to 2021, there was actually an increase in both control and intervention areas, which is most likely due to the impact of COVID, which kind of sat in the middle of those 2 data collection points. So obviously COVID promoted people to make use of more outdoor spaces in their local neighbourhood. But I think importantly for the purpose of this study, when we did an analysis on this and looked at the kind of interaction between time points and the intervention control groups, the increase in self-reported outdoor space use was twice as large in the intervention area compared with the control area. Again, kind of supporting the kind of validity of what we were seeing with the observational data from the Mohawk stuff. So again, supporting that idea that this intervention has had a positive impact on people's use of outdoor spaces. So if you are interested in reading a bit more about that particular evaluation, we published the results last year in Environment International. So that contains the observations and the intercept survey data that I've talked about, and just some kind of ongoing and some future research that we're currently doing for this particular evaluation. So as I mentioned, we've just finished the longer term 5.5 year follow-up with the observations and the survey data, again replicated in August and September. So it'll be interesting to see whether those effects are kind of maintained or sustained in the longer term. As well, as part of my current fellowship, I'm nearly at the end of doing a qualitative interview study with local residents. So the idea with that is we're testing, refining a programme theory using realistic methodology to try to unpick a bit more about how and why that park has potentially had positive impacts on those kinds of physical activity and other wellbeing related outcomes that I've talked about, understanding what worked, what hasn't worked for different population groups, understanding the kind of relevance of the local context to understand a bit more about what we can actually learn from this particular intervention. So those two things are kind of ongoing or been completed. The latter two things that we're currently exploring a bit more, that's kind of a bit more of a work in progress, but one of the things we're looking at is using geolocation data, so analysis of behavioural patterns from GPS enabled smartphones to look at how that's changed over a period of years since the park was built. And then also looking at specifically impacts on young people's health and wellbeing outcomes. So one of the things that has come out quite strongly of the qualitative research so far is really the strong positive impacts that it's had on that parents have reported on their kind of children. So reducing things like screen time, promoting social connectedness, even impacts on things like diet, for example. When kids are running about all day, they become a bit less fussy with what they're eating. So there's been quite a lot of interesting stuff coming out of that qualitative work that's kind of prompted us to do a bit more focus around kind of young children and young people's health and wellbeing outcomes using some local survey data sets in Greater Manchester. So that's some of the stuff that we're doing, building on that particular work around West Gorton. Just in terms of implications then of some of that work that I've talked about, I guess one of the key conclusions that we've suggested is that providing high quality, accessible green space in deprived neighbourhoods can promote green space use, promote walking and these other wellbeing related behaviours. I think one of the most important things from this particular project is the importance of co-design. Sounds quite obvious, but obviously getting kind of the local communities involved in the design of the park has probably had a positive impact in terms of the use of the park and these other benefits that we've seen. So for example, from the qualitative research that we've been doing, some of the stuff that residents have talked about in terms of why that park has worked for them was kind of related to some of the decisions that were made during the co-design process. And we're hoping that this work and other work that we're doing in some of these deprived neighbourhoods in Manchester is starting to inform local decision making on health inequality. So for example, Manchester City Council have their 10-year health inequality strategy called Making Manchester Fairer. So we're kind of feeding some of this evaluation work and learnings into that, the evaluation component of that Making Manchester Fairer framework. And from a methodological point of view, the methods that we kind of developed, that I've talked about today, have and are starting to be adopted in other natural experiment evaluations. So we've got various natural experiment evaluation projects that are completed or ongoing. So number 1 and 2 there have been published. So we did a couple of evaluations, one around kind of more the local street greening project, and the second one was along various walking infrastructure changes along an urban canal in Greater Manchester. Project number 3, which has just kind of started, is looking at a new sky park in the city centre of Manchester called the Castlefield Viaduct Sky Park. That's like an elevated sky park that's been built on an old railway line in central Manchester. And then projects 4 and 5, we've applied these methods in the context of speed limit schemes in Amsterdam. So we're currently writing up the results for that particular study where we applied this kind of mobile methodology over there. And then also number 5, we've got a PhD student who's working on the evaluation of a new train station down in Brent Cross in London. Again, so that's a bit of an ongoing piece of work, but we're hoping that this kind of methodology can be translatable to other settings and hopefully try to really improve the quality of the natural experiment evidence base. So, final slides. Where does this get us? So, I think obviously since that review that was nearly 10 years ago now, we know that the natural experiment evidence base is growing and definitely improving, probably quite slowly compared to the kind of response in policy and practice. So I think we know green spaces are generally probably good for health and well-being. I think what we probably now need is maybe start getting into the complexities and nuances to try to improve our understanding of how these kinds of interventions may or may not work across different population groups and also across different kind of contexts, both physical and kind of social, cultural contexts. I think a couple of things in order to how we can actually achieve that. I think one thing that we can do is maybe try to improve development of theory in this area. So one of the things that I'm working on as part of my fellowship is to develop like a theoretical framework that will help researchers think through a bit more about how these kinds of interventions can be evaluated, and particularly thinking about the impact of local kind of contextual factors and thinking about how an intervention may or may not work for different population groups. And I guess the second thing that we need is, again, kind of just building up this robust natural experiment evidence base, which I mentioned seems to be happening from a lot of the exciting work that's been published more recently in this field. I recently led a commentary that was published earlier this year where I set out some of the potential promising avenues that I think could be utilised in terms of harnessing kind of emerging technologies to try to really scale up this kind of natural experiment base at the pace that I think needs to happen in order to try to catch up with a lot of the response on the ground in terms of what's happening in cities around urban green spaces. So utilising various sources around kind of big data, so smartphones, utilising sensors and cameras across cities. So if you're interested in a bit more of that kind of thing, please do again check out that commentary that was published earlier this year. And that's me. So there's lots of wonders to acknowledge. A lot of the work that we've done over the last kind of 10 years I won't go into. But yeah, obviously appreciate the support, and particularly obviously the Leadership Trust and for the funding support on the fellowship that I'm currently on. So I'll leave that there. Thanks very much, everyone.
Thanks very much, Jack. That's really interesting and really kind of, the case study was really neat. I can see definitely loads of stuff that we have conversations about locally about that's been done where that methodology could apply. So yeah, thanks.